When you're looking for non-melanoma skin cancers, those would be the basal cell and squamous cell carcinomas. You want to look for sores on your skin that don't heal, spots that bleed, rough red spots, spots that are changing. Now, when we're talking about melanoma, you're going to look at a few things. We call them the ABCDs, and that's the way you identify a normal mole from a melanoma. So if you have an asymmetrical mole where one side doesn't look like the other side, that's a bad sign. Border irregularity is the next thing you need to look for, and that means that it's not a well-defined, smooth border. It's got an irregular scallop border or diffusing pigment in the skin. The third characteristic you use to distinguish between a melanoma and a normal mole is color. If you have a uniform brown mole, then there's probably nothing to worry about. However, if you have multiple colors or a black mole, then that's more serious and you need to have that evaluated. And the fourth characteristic is the size. If it's greater than 6 millimeters, which is approximately the size of a pencil eraser, then you also need to worry about it. And the nice thing about moles is that they're right there on your skin for you to see, so you can just sort of do a self-check on your moles, and if there's anything unusual, if moles are changing or growing or bleeding, then you really should have them evaluated by a dermatologist.